Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Mahmood Shalabi and I work for Medical Aid for Palestinians as a senior program manager in their Gaza office. Throughout the last aggression on Gaza, which continued for 11 days, Medical Aid for Palestinians was one of the most active emergency respondents as ever in any other emergency. We were able to deliver urgently needed and life-saving drugs, disposables, and equipment. Without those items being able and provided to the Palestinians in Gaza Strip and the health system, many would have suffered fatal consequences as a result of the aggression and because of the blockade that has been imposed on Gaza for more than 14 years. The blockade means that there are scarce resources inside of Gaza Strip, and without the support of organizations and other people, such as Medical Aid for Palestinians, this means that there won't be much available medical supplies, drugs, and disposables for the benefit of the health system to be able to save lives as urgently as needed. In a nutshell, that's what we do in an emergency. We pre-position stock and we release it immediately when there is a mass casualty event, such as what happened in May of 2021. We also have a project related to zero stock, which is stock that is continuously unavailable inside the Ministry of Health. We procure those items urgently and provide them to the ministry. And we have other projects related to the emergency preparedness for the benefit of the health system inside of Gaza. It is with great pleasure that I tell you that Medical Aid for Palestinians has collaborated with Humanity Force during the 11 days of aggression on Gaza. This partnership included the provision of urgently needed emergency care items in terms of IV fluids that are needed inside of emergency departments and also for trauma cases inside of the theaters of the Ministry of Health. Without those fluids, many lives would be at risk, either for mortalities or morbidities or long-term disabilities. In addition, as part of the continuous support that we provide the ministry and as part of the continuous needs for the health system for other vulnerable groups and other vulnerable people, the Ministry of Health communicated with us one day, letting us know that there was a dire need for items related to hemodialysis. Specifically, those are the kidney patients that need, to wash their kidneys on a daily basis. Some specific disposables were actually at zero stock. No items were found inside of the Ministry of Health, and they sent us an urgent email. We communicated immediately with Humanity First, and they immediately responded and provided us with the urgently needed fund, and we were able to actually procure the items and deliver them within 1 week or less to the Ministry of Health. Without these items, more than 100 patients would have actually suffered fatalities. They would have become, dead persons inside of Gaza Strip because of the lack of the disposables that were supposed to be provided as part of the hemodialysis process. The last bit that we collaborated with Humanity First was related to the oxygen cylinders. As part also of the aggression on Gaza, O2 cylinders or oxygen cylinders were in dire need by ambulances and by other, emergency providers. Those are cylinders that are used inside of ambulances and also at sites of demolitions and at the sites of airstrikes when you are trying to evacuate people from under the rubble and you are trying to provide them with an oxygen supply until you are able to extract them. The Ministry of Health was lacking a lot in terms of the oxygen supplies, and they communicated with Medical Aid for Palestinians, and in turn we communicated with Humanity First, who gratefully immediately responded and provided us with a huge fund to be able to procure oxygen cylinders for the benefit of the Ministry of Health. The O2 crisis was at its peak due to the fact that before the May crisis, there was a COVID-19 crisis. Yes, Gaza suffers from COVID-19 such as any other place. And COVID-19 patients require a lot of oxygen support and supply. This meant that the oxygen was focused inside of the hospitals, but there was a lack of oxygen cylinders for the emergency services and the pre-hospital, the ambulances. Those services suffered greatly. Without the support from Humanity First, without us being able to procure those oxygen cylinders swiftly, this meant that the pre-hospital services would have been jeopardized and would have been at a huge risk of being able to save lives during the 11 days of assault in Gaza. In terms of challenges faced by humanitarian workers inside of Gaza Strip, first of all, the first risk that I can think of is the risk on our lives. It is a great danger that we are not able to be provided with humanitarian, access and security and safety during the escalations and aggressions on Gaza Strip. For example, during one day in the 11 days of assault on Gaza, we have a warehouse near where I live in the north of Gaza Strip, and I wanted to go to the warehouse immediately to be able to release the pre-positioned stock that Medical Aid for Palestinians had stored in our warehouses, and those were emergency care related drugs and disposables. I went outside almost 8:30 a.m. and there was no one in the street. There were bombardments all over the place, and it was risky a lot. I was even told by my family that I was crazy, going to the warehouse at that time during the war on Gaza or the assault on Gaza. That's one thing. The other thing is the lack of humanitarian space in terms of occupation. So when your borders are controlled by an occupying force, this means that many of the drugs, many of the medical disposables and equipment are not available in the local market, which means that you have to procure them from an outside source. This means that you have to rely on the borders, and this means that you have to wait, and waiting is not good when it comes to provision of medical supplies and services in an immediate term. Other than that, there are many challenges on the ground, and those are constituted in also the higher prices. So, for example, during the COVID-19 crisis and still until this minute, there are huge prices against the market surveys that we are able to conduct. Sometimes the prices are 4 times or 5 times more. And this contributes, and this is contributed to by the taxes that are forced by the occupation at the crossings, the global, influx of COVID-19 injuries, and the fact that those emergency-related items are urgently needed by everyone else. Those are all factors that are hindering the work of humanitarians inside of Gaza Strip. But the most important one, as I started with, is the lack of safety and security for us to be able to provide the work that we need to do urgently. Sometimes we cannot do it because we fear for our safety and our security inside of Gaza Strip. My message to Humanity First donors is, first of all, thank you so much for being able to support this great organization. Humanity First is very flexible. I have had the pleasure of working with so many organizations and have had so many partnerships in the last couple of years, but let me tell you that the partnership with Humanity First is one of the smoothest and most, comfortable ones for medical aid for Palestinians in Gaza Strip. That being said, please continue supporting Humanity First. They are a great organization, and the partnership with Medical Aid for Palestinians is of great benefit to the health of Palestinians inside of Gaza Strip. Please keep supporting Humanity First. The needs are still humongous on the ground. You are talking about more than 40% of the essential drugs that are urgently needed to save lives that are non-existent inside of the market inside of Gaza Strip or at the stores of the Ministry of Health. This means that you need to be able to provide your donations for Humanity First so that we can procure those drugs for the urgently, vulnerable cases. Disposables also. We have shortages of up to 20 to 30% sometimes of medical disposables. For laboratory items, 69 to 65% of the laboratory items needed for urgently needed cases do not exist inside of Gaza Strip. And the list goes on in terms of equipment, in terms of oxygen supplies, in terms of other, great needs for the health system inside of Gaza. Without your support, we cannot continue to provide our work. So thank you so much for being able to continue supporting Humanity First. And please know that mountains are made of small pebbles, so every penny counts. Thank you so much. Jazakumullah khairan. Assalamu alaikum.
Humanity first, serving mankind. Humanity first, we live.